So, I'm Khalil, founder of the Integral Orthopedics with the fascial integration therapy, and I will show you now what kind of exercises you can practice in our daily life. So, the starting exercise in most cases should be the aura integrate release. So, we often have a lot of stress from former times or from the daily life, and it's good to do that at least once a day to let this stress leave our body. If you should have the idea that the stress does not really leave, we have a possibility to lengthen our arms in our mind. We imagine that our arms get longer and longer, as if they are surrounding a big stress cloud, and we let them get longer and longer until we really feel a release, which is connected with a deep breath. We should consider that old traumata can be stored in our aura, and with this position they can leave our body. So don't be afraid of emotions coming up, like sadness or anger or whatever. Just let them leave your body. But in the usual daily life, it's enough just to open the arms. And it could also be that your pressure is more in the stomach area, in the belly area, so it's not bad also to open it here if you have the idea that you need it. The second exercise, you put your finger in your belly button or navel and hold your front neck. This is the navel integration or navel neck integration. You hold the finger in the navel very, very softly and push it a little into the direction that you feel the inspiration gets deeper, and hold it very softly. And the other hand holds a little the heart area and the throat area. This should give you a feel of pressure. It's better to open again the arms and let the pressure get out, and then put the hand here. The third exercise, you put your hand in the flank area. It's always good to put it on the skin, also with the navel finger, to hold the kidneys, especially when they are cold. Chinese medicine says there's the storage of energy there, and so you fill up your kidneys and the adrenal glands with relaxation and energy. If you should have any scars, it's not bad from time to time, especially initially, also to put, for instance, if there's a scar here, your fingers on the scar and hold it very, very softly in the direction which gives you a good feeling. And as a second step, most scars of the abdomen especially have also inner part. You go with your concentration in the depth of your body until you have the idea that you're connected with a deep scar. For instance, with this cesarean operations, we have this scar here, and also the scar in between the navel and this scar, and then you would put your fingers in this way and go with your concentration in the depth, and to put one finger in the navel, and then you imagine your fingers are getting deeper and deeper until you have the idea that you're connected with the scar. And then you try to imagine that you move it either to the left side or to the right side, and you go into this direction which gives you a release, which is easier. Usually the opposite direction is not possible. The mind says no. So you go into the direction which gives you a release and just wait. And you're listening already that your intestine is working, so that's always a sign that you're activating the vagusnerve. And also the deep breath. And these exercises you should do at least once at a time, at least this one and this one. But also you can do it when you feel very tired or before you want to do something like yoga or sports or go to work or have an exam or whatever. Thank you very much.